Meet Jane. She is 14 years old and lives with her gran. One day, Jane has to go to the Children's Centre at Gloucestershire Royal Hospital after collapsing at home. At the hospital, the doctor says that the cause for her collapse is that she hasn't eaten for a number of days. Ward staff contact the eating disorders service and together they meet with Jane and her gran. Arrangements for supporting people with eating disorders have already been agreed with the team at the Children's Centre, so these can be put in place straight away. This involves putting a care plan together which sets out when, what and how meals are given. The result? Jane starts to eat with support from her gran, and she is able to go home 2 days later. It becomes clear after further assessment from the Eating Disorders Service that Jane has more general problems with mood and self-harm. With agreement from Jane and her family, a referral is made to the Children and Young People's Service, where joint work with the Eating Disorders team takes place. Rather than needing to have 2 appointments, a single meeting is arranged for Jane and her gran with staff from both teams. Jane is offered information and advice about her mood, and they also look at what support gran needs in helping Jane to keep safe. For example, keeping any blades locked away. Gina, a nurse working in the Children and Young People's Service, acts as Jane's care coordinator to make sense of everything that is happening and to keep an overview of her care needs. Jane's mental health needs are complicated, and Gina helps to ensure that everyone involved is joined up in their thinking. She agrees a care plan with Jane and her gran. This describes exactly how everyone is helping Jane, how often she is seen and by whom. It also includes contact details for each person, and a copy is given to those who need it. Since becoming unwell, Jane hasn't been able to attend school. The whole team feel that Jane needs to be doing something during the day, so the local authority arranged for her to start a course for young people who are struggling to go to school. Here, Jane meets other people of her age who are having similar problems. She finds it really helpful to talk to them and keep in touch by text. Gina is able to help by talking to Jane about her worries, which have made it harder for her to go to new places and meet new people. Jane's care needs can now be met through joint working between Gina and a counsellor linked to the Children and Young People's Service. The counsellor meets with Jane every week and provides advice to her on how to manage her feelings, relaxation and distraction. Gina also keeps in touch with the Eating Disorders Service for advice on meal planning, helping Jane deal with wanting to make herself sick and monitoring what Jane is eating. Jane starts to feel happier and healthier, supported by Gina, who continues to monitor and review her progress. If Jane needs extra help, everyone knows where this will come from.